Thousands of nurses, midwives and healthcare workers will be turning out in force all around the country tomorrow to rally for political action to fix the nursing and healthcare crisis. Organised by the New Zealand Nurses Organisation, or NZNO, the rallies are a united call for action from hospitals to aged care and Māori-led organisations. Kerry Nuku from Ngāti Kahungunu Tainui is the kaiwhakahaere for the NZNO, and she's with us now. Tēnā koe, Kerry. Thanks for joining us.
Tēnā koe.
So is this the first time members from across the health system will be united in this type of action? And if so, why is this so important?
Yeah, it's absolutely the first time that we've actually been unified on this kaupapa. And so we're calling every nurse everywhere to come together because the crisis is significant, not just within Te Whatuora, but across the whole entire sector. So we want to raise the concerns of all nurses across the sector. And this is huge for us.
Well, there's obviously some big issues here. We've spoken with you over the last few years and haven't seen you smile too much. Is this action considered to be a strike? Will healthcare workers be required to walk off the job for this?
No, this is definitely not a strike. This is a coming together, a call for action. Maranga mai, let's stand up. Let's ensure that the nurse's role is to advocate for patient safety, patient care. And so this is why this is the right time to do it on a weekend when whānau can get out, they can listen to the kōrero, listen to the rallies, and then make a decision to sign the petition calling on the political parties, making this a political issue, calling on the political parties to adequately invest in a healthcare system in the future, to recognise the nursing crisis and to plan long term.
Kerry, what are some of the biggest issues that you'll be coming together for this weekend?
Well, we've heard a lot lately around the nursing shortage. We've heard a lot in the media around the pay inequities across the nurses across the sector. And what we're starting to hear is around the gross and systemic racism that disadvantages Māori and Pacifica. So this is a concern for members of the public. We need to stop the failings of a healthcare system that doesn't respond to needs. So this is about coming together around those political things that impact on nurses, but also the real things that impact on everyday people of Aotearoa.
Now, through many of our discussions, it's clear that you're passionate about what you're doing here. What response are you wanting from all political parties? What do you want to see happen?
What we've seen over the successive governments is an underinvestment in nursing, underinvestment in healthcare, and a lack of long-term planning. What we want to see is that this becomes a political issue and that politicians from both parties come out and commit to this kaupapa around fixing the problems of the past. We've had systemic failings. We need to stop that because people's lives are at risk. So we hope that those issues are forefront in this kōrero.
What are you talking about when you speak to racism? We've all also talked about this before, but specifically now at this point, before this big rally tomorrow, what are you talking about when you're referring to racism?
So the Y2575 report around the Kaupapa Māori Health Inquiry clearly identified the systemic racism. Not a lot has happened to alleviate that. The recent reports around access of patients to renal dialysis or to kidney transplants showed a marked difference between non-Māori and Māori being able to access those services. These types of things will continue to go on unless we disrupt it, unless we've got patients and community outraged by the inequities and the treatment that a particular groups of the population receiving.
Are you seeing then much positive feedback from your nurses and their patients around improvements, or are things just continuing on the same way they've been for a very long time?
Yeah, what we're seeing and what we're hearing from nurses is that the issue is deteriorating. What is frustrating to us is that despite coming together and saying how critical this crisis is, the government will turn around and say, we've invested this many more nurses back into the system and we don't see a problem. These are people at the coal face. These are people front line. These are people talking to patients, and they're saying, we can't get appointments, we can't move you in, we're feeling that we can't provide and deliver the quality of care that you're deserving because the lack of resources.
Yeah.
So these are the real people of whom healthcare is affecting.
Now, we're still hearing reports of thousands of nurses leaving for work in Australia, ostensibly better work conditions, better pay, potentially better standard of living. What's the ripple effect of losing too many health professionals?
Our workforce has always been reliant on internationally qualified nurses. We've got to make sure that we grow our own, otherwise we'll continue to lose the culture that is ours. That is the unique thing about the system of Aotearoa. If we continue not to lose nurses ashore, we're going to have a very difficult time recruiting, retaining. We're saying that there's anywhere between 4,000 to 5,000 nurse vacancies across the country. If we're seeing them, the workforce that we have already got leaving to go overseas, we've got a huge crisis, unable to recruit, unable to attract, unable to retain.
NZNO Kaiwhakahaere Kerry Nuku, thank you for joining us today and all the best for the nationwide rally tomorrow. Ngā mihi.
Kia ora. Kia ora.